inside. So you see, this is hollow inside. You know, there is gas that goes through.
Here at this University of Illinois at Chicago lab, Graziana Pina is working on research that could change the way post-traumatic stress disorder, or PTSD, is currently diagnosed and treated.
This is a technology that was developed for the first time here in our laboratories.
Someone who has experienced trauma won't always develop PTSD, but women are much more likely to develop PTSD than men. And Pina and Boston University researcher Yael Nolny are narrowing their focus on expecting moms.
Women with PTSD are just greater risk for negative outcomes during pregnancy. So things like, preterm birth or low birth weight infants and postpartum depression, but we don't really understand why.
Currently, PTSD can only be diagnosed by a doctor, psychologist, or psychiatrist. A person needs to exhibit 4 types of symptoms: re-experiencing a traumatic event, fight or flight reactions, and cognition or mood changes. But it can still go undiagnosed because healthcare can be costly or symptoms could overlap with other mental illnesses. And at the moment, pregnant women are only checked for depression.
It would be great to implement screening of PTSD in prenatal clinics. Right now, they're really doing a great job in implementing depression screening. So I think kind of widening our screening would be really important to other mental health problems like PTSD and getting people in treatment. And that could really help prevent some of the postpartum depression.
The researchers say screening for PTSD and potentially other mental illnesses could be easier and more accurate with the discovery of biomarkers. Currently, biomarkers can be used to detect health issues such as diabetes or autoimmune diseases in blood tests.
The field of psychiatry is generally backward as compared to other fields of medicine, where they rely strongly on biomarker assessment. This is also a reason why current treatment for PTSD are not as efficient as they should be.
An accurate diagnosis is important, but so is personalized treatment, especially for pregnant or breastfeeding women.
There is no cure for PTSD and in general for psychiatric disorder. The treatment of PTSD relies on the selective serotonin reuptake inhibitors, so the SSRIs such as Prozac.
In the more than 30 years since Prozac's debut, the medical community has become more skeptical about its effectiveness, and there haven't been any new drug treatments approved by the FDA. So how exactly is Pina figuring out a biomarker for PTSD? He points to a steroid the body creates called allopregnanolone, or allo. Studies show allo levels are lower in the blood and cerebrospinal fluid for people with several mental illnesses.
When allopregnanolone is decreased, both in animal models or patients with psychiatric disorders, we have the appearance of behavioral dysfunction, of PTSD symptoms, for example. So this is a really very important finding because it points to allopregnanolone as a possible biomarker for this disorder.
In March, the FDA approved an IV drug for postpartum depression, the first of its kind. It was developed using a synthetic form of allo, and it sheds some light on what could be on the horizon for treatment of PTSD as a whole.
This also can be very important to decrease stigma that is associated with psychiatric disorders. So that biomarkers have also that advantage on the social level and making people affected by this disorder a bit more accepted by the community.